in the Philippines. Okay, let me share my screen. May I ask kung nakikita yung screen?
Yes po.
Okay. Everyone, I encourage you to open your camera if able. Pero kung hindi ko kayo facilitate kasi nag-iisa ako ngayon. Okay? So, prenatal services in the Philippines. I think this one is one of the DOH program na na-discuss ni Ma'am Cash nung ng Skills Lab. So, it is all about your maternal health program. So, what is the objective of this maternal health program? So, this involves or it improve or the objective is to improve the survival, the health, and the well-being of mothers and the unborn child. So it means it involves the mother and the baby inside his womb, her womb. Okay, so it tackles about the well-being of the mother and the baby. So in your maternal health services, there are a lot na services na gina-offer sa health center about the prenatal, but these are the 4 very important. One is the antenatal registration. Okay, what we will do with this? If we say antenatal, what is the other term for antenatal, everyone? I think na-discuss nyo na ito sa maternal and health child nursing nyo. Another term for antenatal. Anyone? Can anyone raise a hand? Wala. Okay, if you say antenatal, it is a prenatal. Okay, it is during the pregnancy of the mama or the checkup or prenatal checkup. Okay, in registration, this is very because when we were in the community, marami talagang hindi gumagamit ng health center because akala nila may bayad or what. Because but pregnant women can avail the free prenatal services at the respective health center. Free po ang pagpapa-check up ng mama doon sa health center. Hindi po yan siya katulad ng mga OB-GYN na nandun sa mga clinics nila. So we encourage our mothers because one subgroup yesterday told me that their mother has no tetanus toxoid immunization. Am I right? Kasi hindi siya aware na libre pala yung tetanus toxoid doon sa health center. Okay, so we encourage our mothers to go to health center. Another health service na binibigay ng ating health center is the tetanus toxoid immunization. You already talked about this one, the immunization of tetanus in your maternal and health. How many doses nga ng tetanus toxoid ang kailangan ng mama? Yung adequate na para masabi nating okay na yung niya.
5
protected na siya. Okay, 5. So we can say that the mother is a fully immunized mother if she received 5 doses of tetanus toxoid. But 2 doses is adequate na siya, adequate for the mother. But we encourage that she will finish the 5 doses. Okay, it is a series of 2 doses of tetanus toxoid vaccination and must be received by a pregnant woman 1 month before the delivery, and the other 3 is a booster dose. Another health service na binibigay sa health centers sa mga pregnant women is micronutrient supplementation. So what are those micronutrients? So those are the vitamin A and the iron supplement. It is very common kasi sa mga maternal or the pregnant woman, nabababa talaga yung mga supplements niya sa body, which because the baby is dependent sa kanya. So lahat ng kinakain niya napupunta sa bata, or lahat ng nutrients niya sa body is napupunta, nag-share yung bata sa kanya. So mostly sa mga mama, bumababa yung hemoglobin level, which is nag-lead sa anemia. That's why doctors or yung mga nasa health center, nagbibigay talaga sila ng iron supplement. So ano nga yung mga iron supplement na usually binibigay sa mga mama?
Ferrous, ma'am.
Yes, ferrous sulfate. I think nakita nyo naman sa mga mother nyo kahapon, di ba? Meron silang mga ganyan, supplements. And nakita ko din sa other group na nag-a-ask sila kung ano yung mga supplements na binigay ng doctor. But unfortunately, yung iba talaga walang ganito. And I heard then yesterday that the mother is asking you if you can give her a supplement. Yes? Tama ako? Yes. Kung ganyan ang mama, sabihin nyo lang, ma'am, the health center is available po. Nagbibigay po sila libre po doon. Punta lang po talaga kayo doon sa health center. Okay? Okay, another one na service na binibigay sa health center is the treatment for disease and other condition. Okay. As a woman and as a human being, 'di ba, hindi naman natin maiiwasan na magkakasakit talaga tayo. And there are comorbidities na common na sa mga mama. An example of this is hypertension. Especially to those who are mother na matatanda na, hindi naman matanda, yung parang old na during the pregnancy. So, they are called high risk mother kasi nga meron silang mga other diseases or other comorbidities na makakaapekto sa kanya as a mother and as a baby, as sa baby niya. Okay, so what is, akala ko high risk pregnancy na. Okay, maternal health refers to the health of women during pregnancy, childbirth, and postnatal periods. So this is very understandable. So the maternal health, it includes during the pregnancy, during childbirth, and pagkalabas ng bata. Okay, each stage should be a positive experience, ensuring women and their babies reach their full potential to health and well-being. Okay. If someday you will be a mother, being a first-time mother, this is very a stressful event man good sa mga mama, like yung mga first-time mom. Very stressful kasi nga hindi na sila nag-iisa. There is another person inside their body. So the experience is very, very stressful, but very happy siya na experience, overwhelming siya na experience. So the maternal health program of the DOH or the health center will give the mother a positive experience. Hindi lang yung always nagkakasakit siya or may mga na-experience, especially in first trimester. Kasi in first trimester, dyan kasi nangyayari lahat ng morning sickness, ng lahat-lahat. So there is a health center to help you in the program of the DOH. Okay. Because if not treated or not hindi siya na protektahan yung mga mama, it will lead to mortality. Ano nga yung sabi ni Ma'am Cash about mortality? The mother will die because of other complications or other reasons. So about 295,000 women died during and following pregnancy. It is because hindi natutukan yung mga complications at walang alam yung mama about the status of her pregnancy and childbirth in 2017. This was in 2017, but I don't know ngayon. Feeling ko is parang mas tumaas pa ngayon because of the pandemic also. And this is very high na siya. So the most common na cause ng maternal injury and death are the following. So one of the reason na namamatay yung mga mama is because of excessive blood loss. Diba? This is very common. Ay, nagsaspatting po ako, pero they are not knowledgeable na risky na pala ang mag-spot during the pregnancy. So akala nila normal lang yon. There are a lot of mother na di talaga kana knowledge deficit talaga about the condition. So excessive blood loss. Another one is infection. I think I give a reading about infection. What is the common infection in pregnancy? Anyone? If your mother is pregnant, what is the common infection na nangyayari sa mama?
UTI.
Okay, that's very good. UTI, no? Very prone ang mga mother to urinary tract infection. Actually, the women are very prone to UTI kasi nga maliit yung urethra. So if there is a baby inside your womb, she or he will push the bladder sa pababa. So making the urethra very, very short. That's why prone talaga sila sa urinary tract infection. Don't worry, I will be asking someone yung reading about the urinary tract infection to share his or her reading next week. Okay, another one is high blood pressure. Okay, you saw the bag technique a while ago. So what is ano ba yon? Yung parang proof na your mother have PIH. Sige daw, kung naalala. During your dipstick, urine dipstick.
Albumin, ma'am.
What happened to the albumin? Anyone raise your hand? Oh. Nasaan na yung mga students ko? May I call someone? Miss Rial.
Yes, ma'am.
Yes, what is the proof na yung mama mo is baka may PIH during your bag technique?
Ma'am, no idea.
No idea? May idea ka. Dapat nanood ka kanina ng bag technique, di ba? Okay, another student.
Pag positive po yung naglabas na, yung sa kulay ng ma'am,
Okay, sino yung nagsasalita? Hindi ko siya maano.
dahil lang gakit ma'am.
Longgakit. Miss Longgakit. If there is positive result of
After yung result na after nung 30 to 1 minute na result dun sa sa urine specimen niya ma'am.
okay.
Then
So
makita mo siya based sa color ng naglabas dun sa
okay, so that is very good, no? If you do the urine dipstick and if the color changes and there is a presence of albumin, it means it implies that your mother have pregnancy-induced hypertension. So what you will do with that, you will refer the mother to the health center. Okay, clear tayo doon? Clear. Okay, so unsafe abortion. So usually because of knowledge deficit, hindi na nila alam paano alagaan yung bata and it will lead to abortion. So usually meron kasing mga pregnancy like the ectopic pregnancy, it will lead talaga to abortion kasi nga hindi siya sa uterus nag-grow yung bata. So it will lead to abortion. And if wala talagang alam ang mama, this abortion will lead to infection. So kasi hindi na raspahan or hindi na Then obstructed labor. This one is common ito sa mga mama na may CPD, which is the tawag dyan? CPD. Yung maliit ang puwerta, maliit ang daanan ng bata. So ang nagli-lead yan, yung pinipili talaga na maging normal delivery siya. So mawawala na ng oxygen ang bata, nadi-distress na siya. It will lead to death ng baby. So, as well as indirect causes such as anemia, which is hindi na manage talaga ang anemia, malaria, and heart diseases. Actually, last exposure namin during the second rotation sa CHN, we have a mother na hypotensive, as in 80-40 yung BP. When we check the record, medyo meron siyang mga matataas naman na BP, normal lang, meron din siyang So, the mother is very unaware of the situation na hindi sa kanya importante kung hypotensive siya kasi hindi niya nga alam. And we discovered that the first child died because nagsuka daw ng dugo yung baby, yung anak niya na first. So as I was asking the students, bakit namatay ang baby? Because we discovered that the immunization of baby, hindi pala siya naka-receive ng vitamin K. Yung bata. So nag-bleed siya, so namatay. So the mother is unaware of the anong gagawin niya. And that's why this hypotensive pregnant woman, we refer her in the health center talaga. Kasi hindi siya common for a pregnant woman na may 80/40 na BP. We recheck, I think 5 times. Ganun din talaga ang BP niya. So pinatawag siya ng DHW papuntahin sa health center. So that is the function of the nurse talaga. Be aware of the complications, kung ano, at i-refer talaga siya sa health center. Motivate the mother to go to the health center. and other heart diseases. Usually sa mga mama na may mga heart diseases, parang gina-discourage, hindi naman sa discourage, pero gina-discourage kasi yan siya kasi baka hindi makaya ng heart niya during the pregnancy. Okay? So this one. Yes, Miss Amigleo.
Ma'am, question lang, ma'am.
Mm-mm.
Yung sa case nyo, nung sa mother na sinabi mo, ma'am,
Mm-mm.
hindi pala automatic na mag-provide ng mga vitamin K, ng mga tetanus ang ano, ma'am.
Ay,
Pag may magpa-consult or may magpa-hospital, ma'am, like kailangan pa na ang mother mismo ang maghingi pala, ma'am.
Yan din ang kine-question ko sa mga students before, kung paano siya nanganak. Sa bahay ba siya nanganak or sa yung manghihilot lang? That's why hindi niya napabigyan ng vitamin yung bata or yung immunization ang bata niya. Pero the students hindi sila naka-answer sa akin kasi nga kulang yung days to interact with the mother. Pero I think kung nasa hospital and sa right health center siya, mabibigyan talaga ang bata ng mga supplements or yung mga immunization or your vaccination. Kasi nga 'di ba, ang BCG 'di ba right after na maglabas ang bata. Am I right? Vitamin K also. 'Di ba binibigay? I think nakadaan na kayo sa delivery room niyo na na rotation. And sino yung nakahandle dito? Nakahandle na ba ang lahat?
RD lang.
RD lang. Sige lang, next time. Pag may time you will be exposed to delivery room. And you will experience how to to handle delivery. Sige lang. Nyo talaga yan. So this one, according to WHO, there are 810 women approximately die every day. Di ba? Ang laki ng number because of the preventable causes related to pregnancy and childbirth. So that is the goal of the maternal health program. Yung malesen ang mortality rate ng mga causes ng pregnancy or complications of pregnancy. Okay, what are the things to do? I think na-discuss ni Ma'am Cash ito during the DOH program, and hindi lang ito lahat. Marami pa ang kanyang diniscuss doon na kailangan niyong gawin sa health center. First thing to do, when the mother arrive in the health center, you will get what? Anong kukunin niyo sa kanya? Based on your
DS po, ma'am.
anong tawag dyan? Physical assessment na tayo agad. Ano nga yung first na kukunin natin sa pagdating ng
Baseline.
Initial
Demographic data.
database, ma'am.
Demographic,
Yes.
Prof.
Okay, demographic. Very good. So you will ask about, first is the demographic data of the mother. So it includes her name, her age, lahat-lahat. Actually, may form doon sa health center, you will just comply it. Okay? And another next is we will go to the assessment. Diba? Am I right? Ang sa demographic data and the assessment, you will get the height and the weight of the patient, and then we will do the VS checking. Then after that is if we, as a student nurse, if we are allowed to do the pupils maneuver, it's very good no kay para ma-experience nyo. Pero there are health centers kasi na hindi nag-a-allow talaga ng pupils maneuver, especially sa mga yung mga second year pa or hindi pa yung masyadong Pero I think sa mini Fares nag-a-allow sila. And then we will measure the fundic height. I saw yesterday that one group checked for the fundic height. At sinong group yon? The fundic height of the nag-measure. Wala. Pero may nakita ako. Gusto sana ko kayo sitahin, but in front of the mother kasi you cannot get a fundic height if your mother is in sitting position. Am I right? Okay, you just dapat you put the mother in a lying, relaxed position. Okay, when you get the fundic height and you will do the Leopold's maneuver. Hindi yung nakaupo siya because the tendency, because of the gravity, the baby will go down. Diba? magbaba siya na position. So, dapat naka-lie position siya. Okay, another one. We check the FHT. Okay. Anyone here experience checking the FHT during your delivery room rotation?
Ako, ma'am.
Oh, very good. So, ano yung narinig mo doon? Sino ito?
Real, ma'am.
Oh, Miss Rian.
Paspas yung heartbeat.
Oh, para siyang ano no, para siyang
Lisod ka,
ano
ayo
ng
siya
kabayo.
ipon. Oh,
Yes. Oh. Lisod siya ihapon, ma'am. The fetal heart rate kasi it is ma-affect siya na movement outside because the external factors. If the mother is on resting position and ano siya, a resting position din yung bata, hindi walang stimuli outside, ma-appreciate mo talaga ang FHT. But if the mother is tense or if there is a external factor na nag-affect sa kanya or stimuli, ayun nga, iba-iba, maririnig mo is iba yung rate ng ano, ng heart tone ng bata or heart rate ng bata. But what is the normal FHT nga mga students? I think
120 to 160, ma'am.
okay, 120 to 160. My doctor before said to me that you can identify the gender of the baby according to the heart rate. I don't know if it is true, but I believe because ang doctor na nagsabi. So if the heart rate is higher, your baby is a girl. If the heart rate is much lower siya, so it's a boy. Pero we will base that on the ultrasound. Di ba? We will do ultrasound so that we can get the gender of the baby. Another one is health teaching, which is very responsibility of the nurses. I think mayroong group ako kahapon na nagsasabi sa akin, ma'am, ang rami-raming problema ng aming family, ng aming buntis na mama. So it is your responsibility na to make a health teaching. That's why I will facilitate you about the implementation nato sa next week. Ay para matakal talaga lahat natin yung mga problema ng ating mother. Another one is the IE. What is IE?
Internal examination po.
Okay. If we say PRN, sometimes ano ba, if it is really needed, okay? Hindi yan siya ginagawa yung mga ano lang, normal na 6 months old na pregnant, hindi yan siya ginagawa doon ha. If needed lang talaga ang internal examination. Kapag siguro nagko-contract na yung mama at 9 months old ay yung pregnancy niya, so we will do the IE. Okay. Clear na yung things to do during the prenatal check-up. Thumbs up daw, students. Are we clear with this? Okay. Thank you. Okay, let's proceed to your visits. So when the mother will visit the health center. So ideal frequency of prenatal visits during the duration of the pregnancy. So the first visit will be as early as possible. Once you discover na pregnant ka, you visit the health center. Pero kung ayaw mo sa health center, you can visit your OB-GYN, okay? As early as possible before 4 months or during first trimester. Kailan nga yung first trimester? Hanggang anong months?
First 3 months.
Okay. First 3 months of pregnancy. So your first visit will happen here. The second visit during the second trimester. The third visit during the third trimester, and every 2 weeks na if the mother is 8 months na siya, until delivery na natin siya ipapavisit sa health center. So tandaan yan ha, first visit as early as possible before 4 months or during first trimester. Okay. Hindi ako maka-transfer. Okay, what are the laboratories needed na kailangan i-comply ng mama once magpunta siya ng health center? Number 1 is CBC. Okay, what do you think? Why do you think that the mother needs to comply with CBC? Bakit kailangan siya kunan ng dugo? This is very understandable na. Anyone daw? Miss Orcahada.
I-check if may infection, ma'am, kasi magtaas ang WBC po.
Okay, one reason. Another one. Miss Amigleo.
I-check yung hemoglobin level niya, ma'am, if within normal values, baka anemic si mother.
Okay, that's very good. No, so the mother needs to comply with CBC because yun nga, usually baka anemic ang mama or there is another problem with the blood. Ano ba? Yung mga blood components niya. Okay, because sometimes dyan siya nakikita yung mga problem. UA. Alam nyo na yan. We ask the mother to do urinalysis because of the UTI. Baka may UTI yung mama, it will affect the baby. Ultrasound. How many times the mother will do the ultrasound? Anyone? Hello? Tawagin ko nga yung iba. Baka ano na yan dyan. Miss Asturias. How many times?
I don't have.
Hindi kita maano. I think your mic kay may problema. Okay, I will answer na lang. So, usually, you are required to do 2 ultrasound. First is yung vaginal sonography, which is in the first trimester siya ginagawa. And the second is on the 6 months of the baby, which is yung month na yon is complete na yung body parts ng bata. So doon na malalaman ang gender din ng bata during 5 to 6 months. Okay? But there are mothers, meron pa talaga mga ultrasound na ginagawa like, nakalimutan ko yung isa, yung genetic something, yung dinidetect niya yung mga anomalies sa mga baby. Ano ba siya? Na siya ano ba yan? Cleft, lip something, ganyan. Or kulang ba ang mga kamay, ganon. Okay? Blood typing. Why is it very important to get a blood type of the mother? Miss Chave.
Sa ano ma'am, yung parang sa RH factors na ni ma'am. If RH
Okay.
positive.
Yes, very good. So that we will know the RH factor also. Kasi nga, there are babies na iba yung RH factor niya sa mama and sa kanya. Okay. And also, this is also a preparation during your delivery. Kasi ano nga nangyayari kapag nagde-deliver na yung mama, there is blood loss. If there is a lot of or massive blood loss, automatically the doctor will order blood transfusion so that automatic alam na ng doctor anong blood type nito, anong kailangan natin ipa-comply sa family members pakuha ng blood products. Okay? Okay, what are the common tests or during pregnancy? So, when I was pregnant, actually, ang ginawa lang talaga sa akin dito is the FHT, the OGTT, and the genetic screening. Amniocentesis, it is like, na procedure. Invasive na siya na procedure, and the chorionic villus sample. Actually, these top 3, the same lang ang kanilang function. The genetic screening, ang kinukuha na sample ito is the blood. The specimen is the blood. Amniocentesis from the word amnio. Ano nga ang kinukuha dito?
Amniotic fluid po, ma'am.
Okay, amniotic fluid. The chorionic villus sampling. Anong kinukuha dito? I think natakal nyo na ito. Wala. Okay. In chorionic villus sampling, ang kinukuha dito is a small part of your placenta. Okay? So sa genetic blood, amniocentesis, amniotic fluid, which is ginatest nila ang cell if there is a genetic problem on the baby or any anomaly. Kasi dyan nila nakikita yan. Ang chorionic, a tissue from the placenta was taken because sa tissue makikinat din yung genes within the yung mga genetic na mga problema. Okay, fetal monitoring, which is your FHT, and your glucose, which is the OGTT. Ano nga yun? Oral glucose tolerance test. Yan siya, OGTT. What the doctor will do, magfa-fasting ka 8 to 10 hours. They will get you they will check your blood without something na naka-NPO ka talaga. Then after that, na nakuha na nila ang blood, paiinumin ka ata ng 2 glasses or parang ganito kataas na glasses ng soup